So I think it's let's talk a little bit about the pricing and the drug company models, and we'll move on from there.
Okay, so and if we are spending too much on our health care, you have to ask yourself why is that, and how would you go about fixing that situation? And one of the things that is kind of unique in the United States system is because our insurance is a third-party payer to the drug companies and the hospitals, the doctors, and the various service providers, the people don't experience paying the bills themselves. And I think this, because we're somewhat insulated from the true cost of certain products, to an extent, we don't care what the price is. And this allows some of the providers to overcharge what would normally be considered a reasonable price for that. I read a recent article in the newspaper about a gentleman who needed a knee replacement, and he found out that his artificial knee in the United States was either between $26,000 and $39,000 just for the appliance. It was an additional $60,000 for the hospital and doctor to put it in. He was looking at an expense of about $100,000, which was rejected by the insurance company as a voluntary expense on his part, a discretionary expense. He could not afford $100,000. The insurance company wouldn't pay for it. So he went looking around the world, and he was able to buy a ticket, fly to Belgium, have the same artificial knee device implanted in his leg. The whole thing, the doctor bill, the appliance, the hospital stay, the round-trip plane ticket cost him $13,000. The cost of that appliance in Belgium was $2,000 versus $26,000 to $39,000 in the United States. I will guarantee that the device manufacturer did not lose money selling that device at $2,000 in Belgium.
So why is that? Why do we think that we're charged so much more here than in other countries?
Well, the primary thing is, the drug, all of the medical service providers have strong lobbying forces in Washington. You have about 435 representatives and 100 senators. That's 535 people. And there's over 1,000 medical lobbyists in Washington, D.C. 2 lobbyists for every congressman. And basically they get special laws and rules passed that protect them.
And one of the rules or law that was passed was that Medicare could not negotiate with the drug companies, even being the largest purchaser of prescription drugs in the United States, could not do that.
That's correct. In 2005, I believe, they passed the Medicare Part D coverage provision for Medicare to cover prescription drugs. And that was a particularly bad law from the standpoint of law. It was good for the people. People got the drugs that they needed. The bad news is, as you say, the law provided that the Medicare could not negotiate for discounts on the drugs.
Well, it's interesting, the point to where the same people that complain about keeping the systems as it is because they're hearing the lobbyists and the marketing people for the larger drug companies fill the air, the internet, emails with this information are the same people that are having to either drive to Canada or Mexico to buy the same drugs at a third of the price. That is something that you and I have talked about to where we don't understand that. Why is it that Medicare, the largest purchaser of prescription, is allowed not to negotiate, yet the voters will support the bill that doesn't allow Medicare to why do you think it is? Do you think it's as simple as lobbyists and propaganda that allows us to be charged so much, or is there something else like medical liability, insurance? Because one of the things that gets thrown out is medical liability is so high that the doctors can't afford to practice, and therefore they cannot afford to lower their pricing. Tell you what, in Houston, Texas, just driving down behind Rice Village or in River Oaks, I see the homes that some of these doctors are living in. They're not hurting for money.
Not at all. Just to give you a personal example, I needed to go have a cream. I had to go to a doctor, was prescribed a cream for a condition, and I went down to my local Walmart to have that prescription filled. And the doctor had given me a special card, a discount card. And I read the card. It says you can use this card for any insurance that you have, except you cannot use it for a government insurance policy such as Medicare. So I asked the pharmacist with the card, what's this thing going to cost me? And he said, well, it's like $40. And I said, well, if I didn't have the card, what would it cost me? And he says, well, that would be like $120. And I had company insurance. And I said, well, let me ask you another question then. If I was on Medicare, that was my insurance provider. This card says that it's no good if you have Medicare. What would the cost on Medicare be for this? And he said, well, it's $320.
Now, isn't that exciting to hear that? To where Medicare, which is where everybody complains about cutting and stuff, the Congress and Senate passed a law to where it pays $300 for a medication that you got with the card for around $40. So people, let's get real. Our lobbyists are working on our Congress and Senate to make it to where they make money for the companies that they're lobbying for. So let's be honest about things to where if we want the system to be good, if we want to cut costs, we need to get this law changed to where government can negotiate with the drug companies to get the prices down. It's also a Trojan horse argument about, that the medical liability insurance is so high that you cannot do business in America, and a lot of doctors are going away. That's entirely untrue, because if you look at the number of doctors, new doctors coming out, we're not hurting for that. What's going on with some of that is some of the specializations are being cut by hospitals and insurance companies to lower the cost, to where there's no reason for 7 radiologists at the Houston Memorial Hospital to be sitting around waiting to read x-rays when those same x-rays can be read in Costa Rica or India or someplace else at a tenth of the cost. So are some of the specialties getting hurt? Yes. Do we really need to have 7 radiologists sitting around all day long not doing anything, waiting for somebody's x-rays to be read? And no other business that's allowed. So barring the moral issue of granny falling down, getting hurt, and not having a radiologist present, or having to wait 5 minutes for that x-ray to be read in Costa Rica or India or someplace else in the world, those are the decisions our government needs to make. Those are the decisions that any company would make. Those are the decisions we should make in our own private lives. So why sit there and pay exorbitant fees? Well, part of that, and we'll jump into that in a minute, are scammers and fraudulent billing practices, to where you have doctors signing up 6 or 7 different condition codes for one doctor's visit, when in the old days a doctor would have just charged you for a hospital visit or an office visit and call it a day. And I'm going to turn it over to Rich to talk a little more about allowing the government to automatically audit and also look at the drug company pricing.